You know, I personally have never had the opportunity to look into the face of 8,000 critical care nurses and say thank you. And the reason I say thank you is now I'm a consumer. And I've been on the other side of it with several family members now. Nurses step up, get the job done, make me feel very secure in what they're doing. And I've always walked away from those situations with the feeling that nurses are truly committed to making sure that patients and their families have a good experience. So it's a good opportunity to say thank you from the patient and the family's perspective.
They want us really to be caring and to understand the dilemma that they're feeling and the pain and the worry. And as one who's experienced it recently in my own family, when you leave that ICU and you leave your family member behind in their care, you want to know that they're experts in their care, that they know what they're doing, they're critical thinkers, but you also want them to care for your family member like it's their own family member.
In many ways, it's a very emotional experience for the individual making the decision. And I've had to make that decision myself in my own life for a loved one. And, you know, as many times as I've helped other families to come to that decision, it was not easy.
And I think the greatest thing that we can probably remember is that these are people that have, you know, they're someone's mother or someone's brother or someone's son or someone's best friend. My most recent experience as a family member, well, my friends here know that my son was just in the hospital yet again, and the nurses were so great with him. He's a teenager. He's 17 years old, and when he got admitted to his room, they saw that he was a 17-year-old. They didn't make him put that robe on. You know, they let him stay in his T-shirt and his sweats, and they just really honored the fact that he was a patient, that he had feelings, and he was really embarrassed to be there. And I know that they were looking at him as not just any patient, but their patient, that was a really important part of what they were there for.
I always reflect back to a time when my daughter was diagnosed with a really rare bone marrow disorder. It's called Fanconi's anemia. And at one point, her health was really declining. She was in the ICU. And I'll never forget, I received this call from the ICU nurse. And I went in, and I was, you know, just spending some time, and then I looked up at the monitors, and, you know, the numbers started jumping up around, and things started happening. I just waited, you know, as they frantically tried to save her life. Just remember this voice of the nurse telling me, you know, I'm so glad I called you. And then she says, I made everything ready for you. And she brought me into the room. And I, you know, didn't know what to expect. You know, when I left her before, she was hooked up with everything. And there wasn't any tubes, there wasn't any vent, everything. She had removed everything, and that's what she meant by she got her ready. There wasn't a barrier between us, and I was able to really be close and spend that time in that quiet time that I had with her. And I realized, you know, I never got a chance to say thank you. Thank you for, you know, taking that level of compassion so that I could be with Sharon without all the invasive, you know, equipment that was there. And so now I get a chance to just say thank you. And I would like to say thank you to all our nurses because they all have that same level of commitment and care. And that's kind of what my heart's at when I talk about my nurses.
You walk away feeling so grateful and so profoundly affected. I think for patients or their families, it's difficult to go back because going back means reliving it to a certain extent, and I hope they know that we do think of them often.
When Mom was in ICU, the nurses were like family. And when she did pass away, they were all supportive and always there for you. And I would just want to thank them there for being there for us. Thank you.
This is an absolutely perfect opportunity for me to thank a special nurse and basically all critical care nurses. So, thank you.
If I had an opportunity to talk to these nurses, I would say thank you. Thank you for the quality of care that you provide to us and our family members.
I ended up having a heart attack at 45, and that was really my first big experience with nurses. Having a heart attack or any kind of traumatic illness, it kind of wigs you out a little bit, and the fear is overwhelming. And if it weren't for the nurses, I don't think I would have recovered as fast as I did recover, because they are the ones that really helped me and saved me, got me back on my feet, letting me know it was going to be okay. And what is the greatest thing in my life that I'm so proud of is my daughter is graduating college next month with her RN BSN in pediatric oncology, and it's all because she decided that when she was young she wanted to be a doctor. But after her back surgeries and my heart attack, it was, I don't want to be the doctor, I want to be the nurse to take care of the people and be there with my patients until they're well.
It is always comforting to me to have nurses nearby. They're the people you can talk to, the people that you know can connect with you on a personal level. That you know that they will give you the information that you need and take the time to do that. So for me, being a consumer is a comforting thing when I am with nurses.
Just the compassion and the understanding, the patients, the nurses that I've come in contact with, they're just awesome. And I appreciate them and thank God for them because they're just wonderful people.
I really found that having the perspective of meeting the nurses, particularly at NTI, actually, I have that personal interaction with them, knowing what it takes and all that they need to be able to take care of people. And as I said earlier, just knowing their heart and that, they care about people so much, that really helps me to know that when my parents are in hospital that they're getting that same kind of treatment and care.
I appreciate their dedication, to come to NTI and to further educate themselves is also inspiring to me as a potential patient, to know that they're there trying to improve their skills and improve their knowledge and so that they can take better care of patients.
By us certifying and educating nurses, it makes me feel that we're, we're contributing to the world and helping out people.
Because a big part of my job is needing to know what nurses do and what they need, I get to talk to a lot of members. And what is always so inspiring to me is the stories that I hear. I think it's an absolute privilege to meet the needs of nurses and to tell their stories, and that's what we do.
You are why I love coming to work.
You are why I feel that I'm making a difference.
You are why I put my heart into everything I do for you.
You are why I strive for excellence.
You are why I love coming to NTI.
You are why I still have a daughter who is also a best friend.
You are why I love my job.
You are why my work has meaning.
You are why I wake up every morning. Thank you.
You are why.
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 You are why.